Hi, my name is Sancy Arvino, and I work for Child Trends, a nonprofit research organization based in Bethesda, Maryland. Today, I'm going to talk about a project Child Trends is currently conducting in partnership with the School-Based Health Alliance. The project is designed to identify innovative approaches to providing family planning services to underserved adolescents and young adults in school-based settings. And the project is funded by the Office of Population Affairs. The project is currently ongoing, but from the data that we've gathered so far, we're learning that school-based and community college health centers are using a wide range of innovative approaches to overcome obstacles such as a shortage of trained providers, funding constraints, or political opposition to be able to provide quality family planning services to young people. The effects of the COVID-19 pandemic have also added new hurdles, for example, school closures, but providers have responded quickly with outside of the box strategies to help ensure that the young people they serve are still able to access care. So the project has three main objectives. The first is to identify innovative strategies that providers are using to provide these family planning services to underserved young people at school-based and community college health centers. The innovative strategies were identified in two ways. So first, we conducted a literature scan using key search terms. We ultimately had 149 keyword searches, saved 282 sources, and abstracted information from 113 journal articles, news articles, and web pages. And simultaneously, our team began conducting semi-structured interviews with providers and administrators at 35 school-based health centers and 4 community colleges. Once we've collected all of the data and analyzed all of the data for this project, we hope to be able to share the innovative strategies we've identified widely with practitioners, administrators, researchers, and policymakers in an accessible format, such as a toolkit or a series of webinars that will ultimately meet our third objective of increasing knowledge of the innovative strategies that are currently being implemented nationally. So I know I've mentioned the term innovative quite a few times. And so for more information on how we defined innovation for this project, please refer to a presentation by my colleague, Janita Parrick, entitled Innovations in School-Based Family Planning Service Delivery. And that's in the Adolescent and Sexual Reproductive Health session titled Sex Education. For this presentation, I will just provide a few examples of what we're finding as innovative strategies in the literature, as well as through the interviews we're conducting. So for the first example, we heard from several providers that it's really important to increase awareness among students that the centers are there and what services are offered. And so some providers have used presentations in classes, such as a health class, to provide education about contraception and review confidentiality, and then also let the students know about the services that they can receive within the center. Other schools have invited all of the students to the center for a tour, and they use that opportunity to make a fun, interactive learning experience for students. Some schools even can offer universal STI screening during these events to reduce the stigma associated with that. For our second example, we've also heard that it's important for providers to remove barriers for students to access care. So one strategy that providers have mentioned is to create a hotline that students can use to call or message providers at any time. Students can ask questions related to sexual and reproductive health and services. And the hotlines can also be used to send appointment reminders, which can help minimize no-show rates. So this seems to be a strategy, one of the more commonly used strategies, likely because it's relatively easy to implement. We also, in our third example, we know that schools are utilizing technology and telehealth to provide education and services. So for example, providing students with a tablet while they're waiting for their appointment, where they can access an app that will provide information on contraception. This will reduce the amount of time that providers spend reviewing options and help students make an educated decision about what method will work best for them. Centers are also utilizing telehealth, which has become particularly important during the COVID-19 pandemic to provide education and services to students virtually. And along those lines, for our fourth example, some centers are also utilizing social media platforms such as Instagram to provide education about sexual and reproductive health and services to students. And some providers have noted that this may be a way to spread information widely in a way that really resonates with young people. And our final example today that may be especially relevant for high schools and community colleges that may not have the capacity to provide full health services on site. The strategy is to establish strong referral partnerships with nearby health centers or utilize mobile health clinics that can visit the school to ensure that students can still receive access to services that may not be offered within the school itself. In addition to talking to individual providers from across the country, our team also wanted to look at the big picture, and to do that, we examined data from the School-Based Health Alliance's National School-Based Health Care Census data from the 2016-2017 cycle. This is data that already exists. It's just not been explored in this way previously. And so what we've found by looking at it is that in the 2016-2017 school year, 27 states had at least one school-based health center that reported dispensing long-acting reversible contraceptives and oral contraceptives on site. So we have this map here of the United States, and those 24 states are on the map in blue. And then we have 8 states that had at least one school-based health center report dispensing oral contraceptives or long-acting reversible contraceptives, but not both. And those are the states that appear on the map in the lighter bluish green color. There were 15 states where there were not any school-based health centers that reported providing long-acting reversible contraceptives or oral contraceptives on site, and those states are in white. And lastly, there are 4 states and 5 US territories where there's no information available, and that is in gray. So to wrap up, I just want to acknowledge Elizabeth Cook, Sydney Briggs, Erin Sullivan, and Jennifer Manlove for their work in contributing to this presentation. The authors and I would also like to thank the project co-investigator, Janita Perek, and our project officer at the Office of Population Affairs, Callie Coasters, for their leadership on this project. We would also like to thank the School-Based Health Alliance for their partnership. For any questions related to this presentation, please email me, Sam Ciaravino, and my contact information is listed on this slide. For more information about the project, please visit the project page linked on the slide. And lastly, we just wanted to note that we have uploaded our project description and a brief that we authored on strategies that providers are using during the COVID-19 pandemic to continue to provide services to students. So we uploaded both of those documents along with these presentation slides for reference. Thank you so much.